This video is for anyone considering working in mental health, especially those who are considering working in any sort of inpatient unit where you're going to see very acutely mentally, I don't like to use the word ill necessarily, but patients who have acute mental conditions. And I want to mention this because I made a video recently where I kind of lost my not necessarily in a bad way. I just got like super emotional and I started to cry and I'm like, my God, there's a lot going on here. And I made another video where I think I said 5 reasons not to go into psych nursing. And I don't know if I actually mentioned this, but when I made my other video, when I was losing my shit, I thought to myself, my God, bro, like that's actually a big reason. I don't want to say not to go into psych nursing or to work in some sort of inpatient facility, but it's definitely something to consider. Is that if you're an empath, if you're someone who's very empathetic and you feel like you can really fit into someone else's shoes and sort of understand their experience, and you might be like a highly sensitive person, the reality is there is a lot of stuff that you can experience, you can witness, and a lot of patients you're going to interact with, and all of this stuff that you're experiencing can potentially be very emotionally taxing and traumatic to you. So it's just something to consider, because I know there's a lot of people who are empaths, which is what we need. We need more empaths, but if you're one of these people who is very empathetic, it can be difficult to work in psychiatric care because it can be legitimately traumatizing. And I was just thinking about it as I made that video and was kind of losing my shit. I was like, my God, bro, like you... There's probably a lot of stuff that I should be seeing a therapist for. And I think it's a good idea for everyone who works in psych to have monthly or at least once every few months some sort of therapy session, which I don't. I don't really do any therapy whatsoever, even though I should. And I'm laughing because I totally should. I'm just not good at taking my own advice. I'm very good at giving advice, but not like I'm a huge hypocrite. So if anyone wants to write, you're a hypocrite in the comments, you're definitely going to get a heart because I'm a huge hypocrite. Before you go into working inpatient, you might want to see if it's possible that you could just tour the unit or shadow someone for a day to see if that's an environment that you want to be in on a routine basis. And eventually you do acclimate to it, but I don't know if that's a good thing. It's kind of like, for those of you out there who've watched some of my other videos, I think I mentioned when I first started working in psych, it took me like, I don't know how long it was. I think maybe a month, maybe it was 3 months, maybe it was a few weeks before I felt comfortable just sitting down working on the unit because there's just so much different behavior you're not used to. Now I can go into any psych unit and I automatically feel comfortable. Now, is that a good thing? I don't know. That would be like saying that soldier who they're in their first battle and they're just freaking the hell out, and then like 10 years later they just walk in and it's like nothing. They hear gunshots and they're like not spooked whatsoever. I don't know if it's necessarily a good thing. Like, I think there's some good and some bad to it. I'm able to function better in the environment because I don't have all that anxiety that I initially had when I first started working psych. But at the same time, I wondered if, because I've become so hardened, like, have I lost kind of some of my humanity?
6.5 hours later.
And definitely consider shadowing someone so that you have an idea of what goes on in an inpatient unit, because someone can describe it to you. And it's like when I took abnormal psych once, and I remember reading about all these different mental diagnoses and hearing about hallucinations, blah, blah, blah. But until you actually are there and you witness it and you see people going through it, it doesn't make sense. So that's why I really think shadowing could benefit a lot of people before going into psych. So, and I don't even know if I'm even making sense at this point. So I'm going to stop this video and hopefully you found this video helpful. All right. That was a horrible outro.